it has already been. All right, let's do this. Now, this one says, what's the most likely cause, right? There is a 21-year-old. She's come to the hospital looking nervous, sweaty, with muscle pain and a runny nose. She looks unkempt and agitated. You are looking at emergency medicine questions. Here you would see toxicities, poisonings, right? You would see surgical scenarios. You would see areas where you were doing, you know, CPRs, etc. Now, here is just one thing, one word that would make you come to the answer. What is that? Just one word. Just one word that makes you think of the thing that you're thinking. First of all, it's 21. She's very young, right? And she's a lady. She is sweaty, muscle pain, runny nose, right? Okay, increased secretions, fine. One thing that makes you think of this being not ecstasy, not LSD, not cocaine, not benzodiazepine and heroin, because you guys said that, is that she's unkempt. Unkempt. Unkempt meaning they don't take care of themselves. They do not clean up. You know, people who take ecstasy, they take care of themselves. Cocaine users mostly found in pubs, right? They want to look nice. They want people to be attracted to them, right? Benzodiazepine withdrawal people, they already would be on an overdose, already be on sleeping pills, etc. Yes, the runny nose, the muscle pain, the sweatiness is all good. And heroin is also associated. How do you remember it? You remember it by thinking of somebody you've lost, a friend, or a lover, or you know, an interest, and a relationship interest, or whatever. And when you lose them, you start crying, you start being agitated, you're nervous, you don't want to you know, take care of yourself, you're agitated. That's what they're trying to say to remember heroin withdrawal. But one question that will make you think of the answer is heroin withdrawal is being unkempt, right, Dr. Bachchan and Dr. Samir? Because you guys did say one. Do you agree with that? Or is it ecstasy? Right? Okay. Right, let's see if that is true. That is correct, right? That is correct. Now here we do have some notes. They don't have notes necessarily. Okay. All right, in LSD, in ecstasy, what happens in ecstasy? In ecstasy, a person would spot colors when their eyes are open, and when their eyes are closed, even then they see colors or floating colors. Right? This is a major characteristic of ecstasy that sets it apart from everything else. Also fever, right? Extreme thirst, very important to remember for ecstasy. Dehydration, extreme thirst, and seeing colors, right? That is your ecstasy. LSD overdose, how would you know LSD overdose? They can see the sound and hear and smell the colors, right? It's like they're in love, right? Smelling colors, seeing sounds. That's how you think of LSD. Cocaine overdose. When a person has cocaine overdose, how do you treat the cocaine overdose? How do you treat the cocaine overdose? Naloxone or methadone? I'm asking about the overdose, not chronic management. It's just there on the screen. I'm hoping you guys are following and looking at it. Do you guys see it? Naloxone. Remember this. This is also inflammable. It's been repeated 3 or 4 times. That's why I'm doing it over here. Naloxone is for overdose. For management, it is methadone. Don't forget that. Don't forget that. It is associated with arrhythmias. Very important distinguishing factor. Arrhythmias. All right? Arrhythmias. The second thing you should think of is psychosis. Right? Okay. Let's move to the next question and try in this thing. Hopefully, maybe doing 50 questions today. Right. So this is very, very important. Paracetamol poisoning. Paracetamol poison is very, very important. Now, what is important for paracetamol poisoning? Definitely the quantity of swallowing is important, right? The quantity of swallowing is very, very important. However, what is important is a time when it was swallowed. If a person remembers the time when they swallowed or they took or ingested paracetamol, if they remember the time, not the concentration, if they remember the time, then you should be going for N-acetylcysteine levels, right? Okay, you should be going for N-acetylcysteine levels, which are taken 4 hours after the time of ingestion. Please follow this and make notes. This is important, right? If a person took paracetamol and they remember when they took it, right? They know the time duration, then you should always be going for N-acetylcysteine levels, always, no other way around it, always, if they remember the time. Right? And after 4 hours, if the levels are above the concentration, right, That is when you give them that's when you start treating them with N-acetylcysteine. All right. If they are below, you don't do that. All right. That is important. However, if they don't remember the time, then you have to give them N-acetylcysteine. If they're uncertain of the time, you have to give them the antidote. All right, let's read this question. This one says a 15-year-old girl is admitted in the medical ward after taking 28 tablets of paracetamol along with substantial amount of alcohol. Her plasma paracetamol concentration, which was taken 4 hours post ingestion, is just below the concentration that would indicate N-acetylcysteine, right? So what they're trying to say here is, does it mean that she needs the treatment or not? Which would be giving her the N-acetylcysteine antidote of paracetamol or not? Should we give her the antidote? Yes or no? It's been like she took some time. We don't know when she took it, but we took the concentration and it turns out that it is below the indicated line. So what do we do here? Do we treat her or not? That's my first question. Should we treat her? It's just below. Should we treat her? No, no need to treat her. If it was above the line, we'd treat her. Now, here's the thing. There are certain criteria. Now, in here, what you need to remember, the criteria for liver transplant, when to give N-acetylcysteine, when to send to psychiatry train, right? To give liver transplant, if the pH is less than 7.1, or there are certain 2 or 3 things combined together, if that adds up, we go for liver transplant, right? Activated charcoal is given when they come in within 1 hour of ingestion, right? Within 1 hour of ingestion, that's when you give activated charcoal. So that is out of the question. Because the concentration is just below the N-acetylcysteine levels, right? Like just below the line of indication of the treatment, we do not give N-acetylcysteine. So option 3 is also out of the window. Discharge home. Yes, we can discharge her home. But first thing is psychiatric evaluation. 15-year-old taking 28 tablets of paracetamol. Why would she do it? She's attempting suicide. You want to see why is she doing it? You send her to a psychiatrist. Now, if they told us that they know the time duration and the concentration is below that and everything is fine, right? They just told us that, you know, there is a girl and she's 28 years old or so, and she took the paracetamol, and now they're asking us in options, where should she go? Should she be referred home? Should she be sent to the psychiatry team? Should she be sent to a social service? Should she be sent to medicine ward? What would you do? The scenario is there's a 15-year-old or a 28-year-old. She took some tablets. She remembers the time, and the quantity is not as much as it would be warranted a treatment. But now they're asking, where should you send her? Should you send her to medicine ward? Should you send her to psychiatry? Should you send her to social services, or should you send her home? What would you do? Listen to me. Listen to me. She took some tablets. We know the quantity, right? We have known it. She's just in the emergency department right now. Now they're asking, should you send her to medicine? Should you send her to psychiatry, home, or social services? First, you would send her to medical ward. First, you send her to medical ward. If she is in emergency, she would first go to medical ward. They would first do the levels of N-acetylcysteine. They would first do the plasma paracetamol concentrations. Then she'd go to psychiatry. Do you see here? She's been admitted to medical ward, right? She's been admitted to medical ward. If the question says she's an emergency, where should you send her next? Medical ward. They would decide whether she needs to go to the psychiatry or she needs treatment. In emergency, there is just initial treatment. You guys understand what I'm trying to say? Yes? I'm hoping you are. So I'm going to move to the next question. Medical, then psychiatry. Very right. Okay, so I hope they have this. Right. So these are the features. You definitely don't need to remember them. When to discharge. This is important. When to discharge. If you want to take a screenshot, you can. When to discharge, when the plasma concentration of the paracetamol is less than 150. Right? Less than 150. When to admit, if presenting within 8 hours. 150 milligram or unknown amount. Right now, here's the thing. Unknown amount, you know the time duration, but you don't know the amount. You have to admit them. You always have to admit them. If they took 24 tablets, then you have to admit them, right? When do you do a paracetamol concentration? When they present more than 4 hours. It's been more than 4 hours, and you know the time, or the amount is unknown, right? You know the time, or the amount is unknown. You know the time and the amount is unknown. That's when you do paracetamol concentration. When do you give N-acetylcysteine? When there's a staggered dose. That means that they took it in steps, right? They took it one by one, like some at one time they took 3 or 4, then another time they took 3 or 4. There was a staggering in the overdose, right? All were not taken within 1 hour, right? They were took in between the times. Secondly, when you don't know when she took it, regardless of the plasma paracetamol concentration. Do you see what they're trying to say here? In the previous thing that they're saying is that if she took it within 4 hours and you don't know the amount, you're definitely going to give her, you're going to go for serum paracetamol concentrations, right? If you do not know the time, and regardless of what is the plasma concentration, you have to give N-acetylcysteine if you don't know the time, right? Once you have the levels and it's above the line, give them paracetamol. If they present late and they've ingested more than 150, right now, you know the time, right? You obviously know the time that they presented late and they have took the dose which is supposed to be taken to get into poisoning. That's when you give N-acetylcysteine. Activated charcoal within 1 hour. All right, guys, this is something that you need to remember. Now, when do we go for liver transplant? These are the only questions that you'd get for paracetamol, right? You'd remember it once you've done it more than 3 or 4 times. All right, okay, so don't worry about it. I'm hoping you guys are following. Here it says, when do you go for a liver transplant? You go for a liver transplant when the pH is less than 7.3. In most of the scenarios, get 7.1, but if the pH is less than 7.3 within the 24 hours, that's when you go for a liver transplant. Just the pH. Or if these 3 things are combined and you have grade 3 or grade 4 encephalopathy, by that we mean the person would be confused, they would be agitated, they would have liver failure, right? Creatinine is above 300, prothrombin time is above 100. What do you need to remember? PCE, 10-3, PCE 100, 300, right? PCE 100, 300, right? PCE 100, 300. P for 100 seconds, which is prothrombin time. C for creatinine above 300, right? PCE 100, 300. P for prothrombin, C for creatinine, E for encephalopathy. Right, guys? Clear? Should I move to the next question? Does it make sense? I know it'll take time for you to remember this, but I'm just giving you some tricks through which you would be remember it kind of faster than you normally would. I know you guys want to do cardiology. I really do. If I can go back and, do cardiology, I try and get into it. Okay, because this wasn't announced, right? But they definitely get the recordings, right? So this one says, what's the most appropriate management? There is a 5-year-old boy. He was playing with his friends when one of his older friends was holding a hot kettle. Now, I can read the whole thing from the beginning, or I could just go from down above. What is the single most appropriate management? On assessment, partial thickness burns are seen with multiple blisters over the left arm, forearm, and hands. All right. First of all, partial thickness burn with multiple blisters, right? Multiple blisters, partial thickness burn. I'm going to read it from the beginning. But you see, even if I read from the beginning, it's not going to make much sense. I'll tell you why, right? It is going to waste your time, right? So I'm just telling you, always read from down above. Now I'm going to read from the beginning again, but here it is. It says, what's a single appropriate management? What's the single most appropriate management? When you read that, right, look at the age of the person. The age of the person is 5, right? They're 5-year-old, and what they were doing is that they were playing and somebody stumbled water onto them, right? And somebody has run tepid water onto them for about 10 minutes. They were brought to the family, a pediatric emergency, and accident. Now, we don't get much of information in this. We just know that, somebody tumbled water, tumbled water, hot water onto this person. What is important here? It is important to know what is the degree of burn, or how much is the percentage of burn. Do you guys remember how much is the percentage of burn, for the arm, for the whole hand, for the upper limb? Yes, that's true. 9, right? Now, should we go for eschartomy? Should we go for burn dressing? Should we go for deroofing of blisters? Should we go for aspiration? Should we refer to burn service? One thing I want to ask is, in this scenario, we're given 3 parts: left arm, forearm, and hand. Which of these 3 is the most essential thing? Hand. Right hand. If you have involvement of your hand, if you have disfigurement of your face, if you have involvement of your feet, or any part that you use a lot, you need to refer them to burn service immediately. Important. Why? And perineum, very important, perineum, because these areas are, you cannot hear? Can you guys not hear me? Can you guys hear me properly? Right? You need to refer them to burn service. Very, very important. Very important that you understand, right? You need to understand, you need to send them to the burn service because they need treatment. Aspiration of blisters, deroofing, it is done, but not as much, right? Not as much because, they just deroof on themselves, right? Okay, so, but large blisters more prone to rupture, they'll just deroof by themselves. We don't, if we want to, we can, right? In UK, more minor burns will be given to the GP or accident emergency. That's where we'd be going for the burn dressing. Here it is really important that you understand that hands, right? Hands, a perineum, face, these things can be disfigured and they can lead to serious disability, right? Even a disfigured face is disability, right? Nobody wants to have a deformed face, right? I mean, it is not bad, but you're going to have mental torture, right? You're going to be depressed. So these things are important to remember. That's when you refer them to a burn service, right? Clear, guys? Let's move to the next question. All right, you have to remember Wallace's rule of 9, right? I think this was Wallace's rule of 9, I guess. I hope I'm not going wrong. Okay, now, what is the most recommended technique for cardiac compression? This person is 6 months old. 6 months old, what should you tell the parents? It says a 6-month-old boy was taken to the emergency department experiencing an apneic episode at home. He's now completely stable and they're very anxious that their child might die of sudden infant death syndrome, and somebody has done it. Somebody has been through it before. So how would you tell them to do CPR in a person who's 6 months old? I could read the whole thing. I read the whole thing, but what technique I'm giving you? Read the question, look at the age. In most of the questions, read the question, move from down above, look at the age. 6 months old, and they're asking for cardiac compressions. Should you use the thumb? No. Should you use the palm? No. All fingers? No. All fingers of both hands? No. If there are parents, they should be using index and middle finger. If there are parents, they should be using index and middle finger, and you would tell them that you're going to dip it. And can you tell me what is the ratio of CPR in children if a parent is doing it? That is correct. What is the ratio of CPR if a parent is doing it, performing it? 15:2, right? 15:2. All right, 15:2. Here is the thing. If you have the person who, this pediatric person is getting a resuscitation in the hospital, then and there are more than 2 rescuers with duty to respond, then 15:2 should be used, right? Lay rescuers should use a ratio of 30-20, 32. That means that if you have a very expert person, they can go for 30-20. Otherwise, if you are just, just 2 people, right, like the parents are there and you're teaching someone, just ask them to go for 15:2 because it's easier to remember, right? Easier to remember, easier to perform, right? So we just say for pediatric, this is also important for Plab1-2, so do look at it and understand. Is a patient unresponsive? Shout for help, open your airways, look, listen, feel for breathing, then give 5 rescue breaths, check for signs of circulation. Here, rescue breathing is important. In pediatric patients, we start with rescue breathings, right? Yes, parents 15:2. Parents 15:2. If you have a pediatrician, 32. That would also be confirmed and inflammable when you do that, right? So if there is a pediatric person, a child, you have to start with rescue breathing. Otherwise, if it was an adult, you don't do rescue breathing. It's useless. You go for 32, and I'm hoping you guys did go and see Dr. Mike. Did you guys? Because I did tell you that was like kind of an assignment. I'm not sure if you did, but you were supposed to. You're also going to have in your Plab2s your resuscitation, because your exam's in February and May, and I'd want you to discuss this so you could just remember this. I could be saying the thing other way around. Okay. Do confirm it though. Yes. Did you do the calcium renal blockers and asthma? Is it a yes or a no for what? Here, see. This is for who? This is for who? Whom? This is for whom? One person 32, Dr. Nori says one person 32, two persons 15, 2. If there's a pediatrician and they're performing a CPR in a younger child, what should they be doing? Pediatrician. 15-2 or 32? Google it. You guys Google it. Google it so that you remember it. Yes. For pediatric CPR, right? For pediatric CPR, a one person being there, right? A one person being there, a pediatrician being there on his own, right? They are supposed to be doing 32, right? Now there were two parents, and if parents ask, we're going to tell them 15:2, because then again, when we are thinking for two rescuers, right? Two rescuers, as we saw earlier, and you guys are also saying it, two rescuers, infant and child CPR, one person would be doing chest compressions, the other one would keep the airway open, and they'd be doing it on 15:2. So two people 15:2, one person 32, right? Pediatrician 32. Okay, right? 32 pediatric CPR. I think I did say the same thing. Did I not? I don't remember what I said, but if I said wrong, I apologize. Okay, so now again, you have to look at this, right? You have to look at this and you have to see how is a person doing. If you had to do the neonatal resuscitation guidelines, right? This would be for your Plab2 as well. Dry the baby, remove any wet towels, cover and start the clock or note the time. Assess tone, breathing, heart rate. See if they're gasping or not. If they're gasping, give them 5 inflation breathing. Reassess for chest movement. If they're not breathing, then you're going to go for 2% airway control and look for responses. Then start doing the CPR with how many people are available. That's how you would be performing the CPR, depending on who is available and where. Right? Next question. All right. So this one says, what is the single most likely complication to occur as a result of a drug use? Right? So she is also sweating, shivering, complaints of abdominal pain. She was diagnosed with intravenous heroin misuse. Right? Now they're saying if she keeps on continuing the heroin misuse, what complication should she develop? If you want, I can read the whole thing. 22, untidy. That is your first clue. Untidy, taking painkillers for abdominal pain. She is agitated, malnourished, and she's sweating, shivering. She's got abdominal pain, but I don't have to read that. If I want, I can. Like for you guys, what I'm trying to tell you, is it right? Try to read the question from down above. What's the single most complication she'd result as a result of heroin misuse? What could happen if she uses heroin? Schizophrenia, peptic ulcer disease, osteoporosis, venous thromboembolism, seizures. Have you ever heard of a schizophrenia being caused by heroin? You guys have done medicine for sure, right? I know you've gotten it, but you have done that, right? You've been through med school, isn't it? Is schizophrenia caused by heroin misuse? When is thromboembolism caused by heroin misuse? Peptic ulcer disease caused by heroin misuse? Tell me, what is the complication that you think this person would develop if they are using heroin? Yes. Dr. Sheila says seizures. Should we go for seizures? Because two people are saying it. No idea. The rest of you have no idea. All right, let's see if that is true. That is incorrect. Right? Venous thromboembolism. Venous thromboembolism. Yes, schizophrenia, never. Peptic ulcer disease, never. Osteoporosis, never. Seizures, never. Venous thromboembolism. This is why when you would be doing, inshallah, your Plab2s, you would be asking history from people related to their drug abuse, right? So I know you haven't heard of it, but venous thromboembolism can be caused by heroin misuse. My question here is heroin. What is the source, or what is the way through which they take in heroin? How do they use heroin? Cocaine they snort, right? Cocaine they snort. LSD, they also, like taking the fumes of LSD, right? Heroin is IV, right? IV drugs are most likely to lead to venous thromboembolism. So the way you'd remember it here is that heroin, because it's taken in IV, right? IV form, it might lead to venous thromboembolism. It's important to be remembered here, right? Let's see if there are any notes that we can follow. Opioid, we talked about it. Think of someone who is, opioid overdose. How would you remember? You would be thinking of somebody who is, having reduced consciousness, lower respiratory rate, because, opioids can cause respiratory depression. That'll be your clue in knowing how to treat it, right? And look for opioid, right? They'll have low respiratory rate, natal check marks, illicit drugs, and intoxication, right? Complications of opioid misuse, very, very important to remember. HIV, hepatitis B, hepatitis C, infective endocarditis, septic arthritis, septicemia, necrotizing fasciitis, right? Because you're exposing your skin again and again with dirty needles, you definitely get infective endocarditis, you get septic arthritis, you get septicemia, necrotizing fasciitis, because you're going to have Staph aureus invasion, right? Venous thromboembolism, respiratory depression, crime, prostitution, homelessness, these are social problems. We don't really care about them at the moment, though. All right, Claire? Okay, should we move to the next question? Hopefully that is all right. Let's move to the next one. Okay, I'm hoping you guys are not bored, because you did come in looking for cardiology, but here we are doing emergency. Okay, all right. What's the most likely substance she's misusing? She's also sweating, shivering, and complaining of abdominal pain. She is untidy, visits hospital looking for painkillers. She's agitated, looks malnourished. You know it. You should know it. Heroin, right? Malnourished, sweating, shivering, complaining of abdominal pain, unkempt, untidy. That is your clue to it. I'm hoping this is correct, right? This is correct. We did it. We learned it, right? Next time you spot somebody begging in the streets, you got to see if they're untidy, if they do take care of self or not. Because, being poor is not an excuse for being untidy, is it? I'm not sure. Let's not judge them, but still. Okay? So that's how you see whether those are people who are extorting money for heroin or not. Okay, so they're saying what's the most appropriate term to use in his condition? Important. His blood pressure is 92/41 post fluid challenge. Which condition do we give a fluid challenge in? Hemorrhagic shock, septic shock, circulatory shock, neurogenic shock. Which condition do we give a fluid challenge in? Again, hemorrhagic shock, septic shock, or sepsis, neurogenic shock, or cardiogenic shock. Okay, here's the thing. First of all, it's septic shock. Secondly, if they tell you that their post-fluid change is 90/41, and if you look at the blood pressure before, right, what you have to look at in here is two things, right? The first one is the blood pressure right now. The other one is the blood pressure before, right? So definitely they're going to have some temperature. They're going to have a low blood pressure. When you give them the bolus of IV fluid, right, and how much is the change? How much is the change in this situation? It was 88, now it's 92. Can you count from 88 to 92? 89, 90, 91, 92. How much degrees of a change in the systolic blood pressure has happened? 4, right? 4. Is it significant? Is it significant? It's near to nothing, right? It's near to nothing. So what does it tell us? What does it tell us? Is it sepsis? Is it severe sepsis? Is it septic shock? It's not SIRS, it's not hemorrhagic shock. What is it? Septic shock. Non-responsive to IV challenge is septic shock. How much do you think should be the response? Did I choose this? No, I was choosing this, right? Right? How much should be the response? At least 10 mmHg. At least 10 mmHg. All right, at least 10 mmHg. Okay, so shock, septic, neurogenic, cardiogenic, anaphylactic, hemorrhagic. You guys know it already, right? Aim for CVP, right? That's what they're saying. Hemorrhagic shock. Now you need to remember this one here, right? Because you're gonna have questions. You're gonna have questions where a person would come in with an RTA or with a wound and they would lose blood. Once they lose blood, what happens is that you would have to tell them by looking at their heart rate, right? By looking at their heart rate or their blood loss, and either they'll ask you a question about what class of shock it is, right? I'm talking about hemorrhagic shock, and you would have to remember this table. I'm telling you how to remember it. We're going to have 1 or 2 questions right now about it. So I'm just telling you right now that you would have questions where a person would have an RTA or any gunshot, etc., where they've lost blood, right? And then the questions regarding that kind of a shock would be revolving around the class of shock. How much is the blood loss, right? Either the class of shock or the blood loss, or a blood loss in liters or in percentage. How do you remember that, right? So I hope you guys are following, right? Like, do you see over here how many parameters do we have? Blood loss in ml, blood loss in percentage. Either they'd ask you what is the class of the shock, or they'll ask how much blood is lost, or they'd ask how much percentage of the blood is lost. How do you remember this? Class 1 shock. Class 1 shock, you would remember this by the heart rate, right? Mostly the heart rate. In class 1 shock, where you lose 15% of the blood or 750 ml of the blood, there is heart rate normal, right? Normal heart rate, right? Normal heart rate. Look at the heart rate below 100. Is it normal or not? That's normal, right? You guys follow? When you're thinking class 2, where the blood loss in percentage is 15 to 30, or 750 to 150 ml, which is more than 1.5 liters, you're thinking of a pulse rate which is tachycardic, but not above 120. Tachycardic, but not above 120. Try and remember this. Try and remember this. We're just starting out. We're just starting off, but this would be helpful for your next questions, right? This is what I'm trying to explain here, right? If they say that, you know, the person is has lost blood around 30 to 40%, or his heart rate is above 120 but below 140, then they ask you how much blood is lost in milliliters. You'd say 1.5 to 2 liters, right? 1.5 to 2 liters, 1.5 to 2 liters. Anytime the heart rate is above 120, you think of 1.5 liters blood loss. If it's above 140, you think of 2 liters blood lost, which is around 40% roughly. Respiratory rate, you can look at that and remember, right? But most easier way to remember it is with blood pulse rate. Do you guys follow and understand? I know I've kind of put a lot of information in your brain, but this is something that will be helpful in the future questions. All right. Okay, do you guys follow and understand? I know you guys are scared because I'm giving you lots of information right now. Okay, everybody following me? Are you guys bored? You do follow me, right? Okay, that's good. That is good. I'm hoping you do. Okay, just thinking about it. Right, so septic shock, you know what would happen in septic shock and how do you treat it? Now, how do you treat the anaphylactic shock? All right, my question is, if a person is less than 6 months of age, what is the dose of adrenaline that you'd administer them in IM, anterior lateral spect of the mid-third of the thigh? What's the dose? 150. If a person is in between 150 to 12 years of age, then what's the dose? 6 months to 12 years of age, 300. Above that, 500, right? 500. Do remember it in how many parts it is. 1 in 1,000, right? Okay. Now you give it to them in the anterior lateral spect of the middle third of the thigh, whatever thigh it is. Why are we giving it anterior lateral spect? Because anaphylactic shock is life-threatening, right? It's severe. We want to save them. And the only thing that is more exposed is the anterior lateral spect of the thigh. If you look at your thighs right now, I want you to do it. It's a physical thing, right? It is a practical thing, right? Do look at your thighs and see which is the most exposed part, even if you're fully covered. It's your anterior lateral thigh, easily accessible. That's why we go for it. Adrenaline can be repeated every 5 minutes. That's what I wanted to tell you. All right, Claire? Because in future, inshallah, you'd be also telling people how to use EpiPen. Okay, next question. Right. Okay. Now this one says, what is the most appropriate initial management? Pulse is 123, blood pressure is 70/45. There's a butcher and there's a knife in his groin. He's used a towel to stop the bleeding, but the towel is soaked in blood. What's the most appropriate initial management? Blood transfusion, oral rehydration, refer to surgeon, fresh frozen plasma. What do we do? I really need answers in here. Intravenous fluids. That's the first thing, right? ABC. Okay, let's see if that is correct. That is correct. Let's move to the next question. I don't think that I'll be, making you excel on it. And, I know you should enjoy your victory, but let's move to the next question. What's the single most likely injury? This person has a pulse of 132, blood pressure 65/43, so he's hypotensive. There are bruises on the left side of his chest and abdomen. There is noticeable abdominal distension. He was wearing a seat belt. I'm going from up above, right? Like down above, right? Do you guys follow? Are you understanding? Everybody understanding? Dr. Samir, Dr. Sheila, and Dr. Bachchan are definitely replying. Dr. Rija is replying. I don't see the rest of you replying. Do you guys understand? Are you still there? Dr. Anna, Dr. Bahram, Dr. Galaxy, please change your name. Dr. Hiba, Dr. Hina, Dr. Nagma, Dr. Nori. You guys follow? Understanding me? Understanding the question, what is happening here? Is it a yes? Hopefully it is. Okay, good, great. Please do respond. This is why I only take 20 individuals, not more than that. Okay, in each batch. Okay, so good, right? It's splenic rupture. This person was wearing a belt, seat belt, and mostly when you're wearing a seat belt, you would see next time when you wear a seat belt, see where the horizontal belt goes in. It goes over the left side of your stomach and on the anterior part of the abdominal wall. That is where you have your spleen rupture, and this is why there is this abdominal more likely. Left side injury, spleen is more likely. But do see how you wear your seat belts, right? Once you see that, you'd remember it forever if you don't remember it right now, right? Left-sided, okay? This has been repeated lots of times in lots of scenarios. Okay, this one says that was a benefit. Well, you don't fall right out of the car and hit yourself on the curb or the lamp that you've hit your car on or the car right in front of you. I mean, you're still just there, right? You just ruptured your spleen. You're still alive, right? You can be treated. Right, Dr. Haskam? Is that clear? All right. Okay, I know you were being funny. I hope you were. Or was it a serious question? Okay. All right. This one says, what's the single most appropriate next step in the management? He's in extreme pain and is asking for help. All right, I get that. He's having oropharyngeal soot and swelling in the mouth. There's a 12-year-old, there are burns all over his body, and there was a house fire. Now, when you have house fires, the first thing to look at is the mouth. If it is swollen, if it is having soot is blackening of the mouth, right? Blackening of the mouth, you need to do the ETT, right? You need to intubate them immediately, right? Because we don't want to risk a respiratory arrest because of what you didn't look at. This is why initial examination in a burn victim is really, really important. You would call a senior anesthetic. Yes, the rest of the things matter, but this is the first thing, right? This is the first thing. Next question. I hope you guys are liking this because you're doing good, right? This is correct. Okay, now this one says, what's the most appropriate initial step? This is a 35-year-old and she has had a successful cholecystectomy. I'm going from above, but let's just read from below now. What's the single most appropriate initial step? A system examination reveals no abnormalities. If you see nothing here, move above, right? I saw nothing here, so I moved above, right? So she went through cholecystectomy. Post-operative, morphine was given. On examination, the pupils are bilaterally myotic, and she's having a respiratory rate of 7. Now, you know, in a question like this is almost a detailed question. This is a standard length of question that you see on your exam day. How should you skip the verbs, and how should you skip these sentences and move ahead? Number one, look out for your question from down above. Secondly, look at the numbers, right? Numbers. So here's 7. That is a number. What is written there? 7 breaths per minute. Right? 7 breaths per minute. If it's 7 breaths per minute, what is your priority? Should you intubate and ventilate, or should you go for intravenous naloxone? What do you think you should do first? Intubation or naloxone? How do you progress? Should you intubate first, or should you give them naloxone first? Now, you know, in medicine it is said, treat the cause. Treat the cause. Right? Treat the cause. What is the cause here? What's the cause here? What's the cause here? Medicine says treat the cause. We doctors from every part of the world that we are here, what do? We treat the symptoms, right? Mostly in my country. I'm not sure about Nepal. I'm not sure about your countries. UK is far better, but I'm not sure what happens in India or Bangladesh or Sri Lanka. But in my country, we treat the symptoms. What we are supposed to do, we're supposed to treat the cause. So the cause is opioid. If you reverse opioid, the next thing is definitely intubation and ventilation, but first reverse the cause, right? Okay, first reverse the cause. It may be taking some time to just reverse it, then you can go for intubation and ventilation, right? Okay, right? Okay, also depends on how are the sets during that time. Okay, clear, guys? All right. So what's the most appropriate management? There is person and you see a decreased respiratory rate and he's lost consciousness. He came in and he was found to have heroin overdose. How do you treat heroin overdose? Benzodiazepine, disulfiram, methadone, naloxone, diazoxide. How do you treat a heroin overdose? Is heroin an opioid? Okay, all right. When do you give disulfiram? You guys have said 4, I haven't. That is correct. When do you give disulfiram? Alcohol. What is disulfiram used for? Abstinence. For abstinence, right? For abstinence, not for management. Abstinence, deterrent for alcohol. That is true. That is true. You guys are doing really, really good. I think we'll be able to end this, hopefully, in like today and tomorrow thingy. Okay. What's the most appropriate, what's the most likely drug responsible for this patient's symptoms? So she has a temperature of 37.5. She have a normal temperature. She doesn't have anything significant. Move up. 23-year-old accident emergency, came from a party on examination. She claims that she can see colors if she closes her eyes. You notice tremors and dilated pupils. What is it? Is it LSD or is it ecstasy? In which one do you see, smell, and hear colors? No. Think about it. Think about it. Is it LSD or is it ecstasy? Okay. All right. Okay. So you see, I see 1 and 4. So that means we're definitely confused. Tell me something. If you're taking ecstasy, what happens to you? Which one would you be dehydrated in? Cocaine, heroin, LSD, or ecstasy? Dehydrated. Thirsty. Okay, colored hellos, all right, but you're not answering my question. Which one would you be dehydrated in? Ecstasy or LSD? Ecstasy, you guys are saying ecstasy, right? Okay, all right. And which one do you see the smell and hear the colors? Ecstasy or LSD? Like see the smell, hear the colors, LSD. Now here, even though we don't have dehydration, She's saying that she can see colors, right? And we see colors, we don't smell colors, right? So it doesn't point towards LSD here. Does it point towards LSD? I mean, in LSD, what people do is they can smell colors, which is unusual. We don't smell colors unless you're painting your house, right? Normally you see colors. And is it normal to see colors? But she can see colors. She can see colors when she closes her eyes. That is kind of abnormal, right? Seeing colors when you close your eyes, that is kind of abnormal. So should we go for, yeah, so should we go for LSD or ecstasy? Now you guys tell me. I tried to kind of clear it. Now what? Ecstasy or LSD? I want everybody to answer in accordance and in, you know, consistency and in agreement with one another. Where when I say that, you know, normally you see colors. Right now, do you see colors around your room? Right? See, you see colors around your room right now? Do you see colors? You don't smell them. Do you smell your colors unless your house been painted right now? But you're not smelling the color, you're smelling the acetone in there. I guess they put an acetone or whatever they put in there, right? So you can smell that. You don't smell colors. When you're taking LSD, you smell colors. When you're taking LSD, you see sounds, which is weird, right? Okay, which is weird, all right? Okay, that's one thing. Secondly, in ecstasy, what happens is that you can mostly, what happens is that your senses are elevated very highly, and she's claiming that she can see colors. And is it normal to see colors? Is it normal to see colors? Yes or no? Is it normal to see colors? Yes. And if you close your eyes, can you see colors? No. So is it ecstasy or LSD? You guys would reply. I wouldn't. I wouldn't. Because I don't know what it is, really, to be honest. I'm just kidding, but still, tell me, is it ecstasy or is it LSD? You guys think it's one? Okay, you are saying it. I'm not saying anything. Anybody still is? Now, here's the thing. Here's the thing. Always stick with your gut. Whatever you chose first, be very stern on it. That's what I'm trying to also teach you here. Be very stern on what you choose. All right? Okay, let's see if what is correct. You guys, somebody said LSD, they were supposed to stick to it. I am here to give you the reasoning that your brain would give you on your exam day. That is to confuse you. This is not spoon feeding. I'm not spoon feeding you. That's not what I'm here for. Somebody did give the reasoning that, you know, if somebody's taken ecstasy, I guess that was Dr. Sadia, I guess, or Dr. Zoya, that if they are taking ecstasy, they would have hyperthermia. They clearly told us that her temperature is 37.5. Always stick to the first thing. Astaghfirullah for sure. Always stick to the first thing. Always. That is what I'm teaching you here. I am gonna act like your brain from now on, where you would be confused and your brain is gonna give you all the reasonings as I gave you earlier. And I did give you the right reasonings, which was correct. But you have to stick to your gut. Sometimes the gut knows it and your brain doesn't. Right? Okay? Stick to what you know and what you choose first. The hint in the stem is that when she closes her eyes, she sees color. LSD's effects can cause visual hallucinations, agitation, excitement, tachycardia, dilated pupils. Right? If overdose is too severe, the patient may go into coma, right, or coma, whatever you want to pronounce it as, right? And how do you treat it? Benzodiazepines. Now she was excited, she was tachycardic, she had dilated pupils. When do you have dilated pupils? Have you guys ever saw Puss in Boots? Puss in Boots, or do you guys have cats? I have cats. Or do you guys have dogs? If not, have you ever seen cartoons? Do you guys see those? Do you guys watch cartoons? All right, I'm very obsessed with them, even though I'm an older person. Or, you know, when you look at your friend or someone you love, your pupils dilate, right? That is great. Dr. Bachchan, say hi to Julie for me. Okay, so your pupils dilate, you're excited, right? You're excited. Dogs and cats are more excited. They are excited, they respond to you well. So when a person is having dilated pupils, right, when they are excited, right, you are thinking LSD. Again, you are thinking LSD. No hyperthermia in LSD. Okay? Ecstasy has hyperthermia. Okay? Clear? All right. Okay, let's move to the next question. Are you guys enjoying it? Because I'm loving it. Now, you guys have 20 seconds to answer this one because we have talked about it and I did go in a little detail in this one. So you guys have 30 seconds for this. 30 seconds. Read from down above, look at the clues and try and answer. Okay, I don't see anybody replying. The time's up though. Dr. Anna, Dr. Bachchan, Dr. Behram, Dr. Galaxy, please tell me who that is. All right, Dr. Sadia says this. All right, Dr. Sheila says 3. All right, I haven't chose it. I'm going to choose something else. Right, so Dr. Sheila says 3. Yes, Dr. Zoya, Dr. Haskam, Dr. Hiba, Dr. Latitude, who is that? Dr. Hamza, Dr. Maria. Even though I've just given the people who just joined in. Dr. Samir, what's the answer? What do you guys think? What do you guys think? All right. 3, 4, 2. Dr. Haskam says 2. Dr. Nori says 2. Dr. Samir says 3. Okay, let's see if what is correct, right? But were you guys able to read the question in 30 seconds? Yes or no? Okay. Now you have to understand and read the question in 30 seconds though. Okay? All right. First question, do we know the time? Right? We do know the time. We do know the time. All right. Do we know how much she took? Do we know how much she took? Do we know how much she took? We know that. If we knew the time and it was more than 8 hours, hear me out. If we knew the time and it was more than 8 hours, we did not know the concentration, should you be given her N-acetylcysteine? Or should you wait for the levels? If it was more than 8 hours, we should give her. If you did not know the time, but you knew the concentration, what would you do? Would you treat her or not? You did not know the time, you know the concentration of how much drugs she took, how many drugs she took. If you did not know the time, hear me out, you did not know the time, forget about she being symptomatic, asymptomatic, whatever her body weight is, how much is her temperature, we don't care. What we care in the emergency department, you know, they're training you for to be present in their emergency. You have to think and put yourself in situation where you're preparing for your Plab1-2, and after that you're going to be preparing and working in their NHS system, right? Or anywhere in the world, right? Even right now, you have to think like that, that you're standing there, there is this 18-year-old, she's in emergency, how do I treat her? If you know the time and it's 3 hours and you know the concentration, go for the levels, right? Go for the levels first, right? Go for the levels first if you know that, right? If you know that it's been more than 8 hours and you know the concentration was really, really high and she took around how many tablets is she supposed to take that you'd say she's an overdose? How many tablets should she take when you should say it's an overdose? 28. 28. She took 28 tablets. Okay, she took 32. So what do you think you should do here? If we knew the time and not the dose, if you knew the time and not the dose, what do you think you should do? That's what Dr. Sadia is asking, I guess. Dr. Sadia is asking, or Dr. Zoya? Yes, if you knew the time, if you knew the time, right? If you knew the time, but not the dose, knew the time and not the dose, should you treat her? Should you treat her? I'm asking you. No, you have to go for the level. You have to go for the level, right? You have to go for the level. If you don't know the time, you know the concentration, treat her. Right now, we know the time, we know the concentration. What should you do? 1, 2, 3, 4. Now, I'm not going to go for 1, 4, or 5. I'm just telling you it's 2 and 3. Choose between 2 and 3. What do you think you should do? You know the concentration, you know the time. What should you do right now? Plasma levels 4 hours after the overdose. How many hours has it been since she has took the overdose? Look at the question. Look at the stem. How many hours has it been? 3 hours. What should you do? Should you infuse her? She has taken too much. Let's give her Anestel. All right. You guys are saying 3. Okay, you guys are saying it. I'm not. Let's see if you guys are correct. I'm here to confuse you, provide you with the information that you already know, and see if that is correct. Dr. Richa is right. Dr. Richa is right. You are supposed to check the levels first before giving N-acetylcysteine. All right, before giving N-acetylcysteine, please check the levels first. All right, you have to take the concentration. See, it has been 3 hours since she took the tablets. You can wait 1 more hour. She's kind of asymptomatic. You can wait 1 more hour, get the results, and then go for infusion. Right? It is not necessary to start N-acetylcysteine infusion unless the time of the overdose is unknown or is staggered over a few hours. Look at this line over here, this sentence over here. Time of overdose is unknown. Let me just point it out if I can. Where is that thing? All right, here. Right over here. Time of overdose is unknown or staggered. That's the only time when you should be hasty, right? I hope I'm saying the right thing, right? When you should be running to treat them. When you don't know the dose or it is staggered. When you don't know the time of the overdose or it's staggered, right? Now let's read it again because I know you guys have forgot it and we just did it. That's right. Now, if she ingested more than 8 hours, she took it 3 hours, right? If she ingested more than 8 hours and she digested more than 150, right? That's when definitely you treat her. Okay? All right? So even though she took more than 24 tablets, right? If she took 24 tablets, fine. But the time duration wasn't 8 hours. It was 3 hours. You need to look at both the things, right? It goes hand in hand. You guys understand this? Please take a screenshot of this thing. This is kind of important. This is the same that you'd find in Plab1, but if you're working right now and you are, trying to make notes, this is also good. Okay, should we move to the next thing? Do you guys follow and understand? Does it make sense? Are you guys still there or are you guys ghosting me? Good? All right, great, great. I am getting thumbs up. That's good, Dr. Sheila. Thank you. Right. Okay. What's the single most appropriate measurement for this patient? Urine examination is positive for nitrates and leukocytes. The testis is placed higher than the right testis. Testis, I guess I don't know if I'm saying the right thing. 18-year-old rugby player visits the emergency complaining of sudden onset of pain in his left scrotum, which started while playing. He usually is fit and fine, nothing happens, but all of a sudden he had this sudden thing happening where the left testis is higher and the right is, not that higher. So if it's sudden and the urine examination is positive for nitrates, now this is a distractor of sort. If something happens sudden, right, in gynecology or in urology for males, you should do what? Use an ice pack, reassure, antibiotics, right? Or should you be given analgesics? This is mostly torsion, right? You guys are right. It could be a testicular torsion. Let's see if you should be going for urgent exploration or not. That is correct. That is right. I mean, antibiotics, what are you going to do? You don't know if he has fever, right? Leukocytes can be raised. You guys understand? You guys follow? Do you want me to hold on and, like the details? All right. Okay, this is also really important. These are good questions. This one says, what's a single likely diagnosis? All right. She has 83/65 blood pressure. Heart rate is 123. Okay, and she is having 35 breaths per minute. Okay, my question here is that how much blood has she lost in percentage? Even though this is not related to it, but her heart rate is 123. How much blood do you think she has lost in percentage? How much blood has she lost in percentage? If not tachycardic, 15%. Right? In percentage, I'm asking in percentage. If not tachycardic, which is like less than 100, 15%. If she's lost below 120, right, but above 100, 15 to 30%. If she's lost above 120, 30%, right? 30 to 40%. 30 to 40% or 40%? You need to look that up again, but it is definitely above 30%, right? Which is around 1.5 liters to 2 liters, right? Depending on this. Now they're saying that this person has an erect chest X-ray, which shows homogeneous opacity on the lower right lung. What is it? She has 30 to 40%. That is right. Now, what is it? Is it hemothorax or pneumothorax? Is it hemothorax or pneumothorax? Trachea is centrally placed. In pneumothorax, whether it's tension pneumothorax or pneumothorax of the normal sorts, is trachea centrally placed? Is trachea centrally placed? No or yes? No. Right? The lung moves. Secondly, there is accumulation of blood at the lower part of the chest, right? So in the costophrenic angle for sure. This is hemothorax, all right? Okay, how do you treat a hemothorax? How do you treat a hemothorax? Any idea? Anybody working in chest tube, chest drain, right? Okay, now you guys look at this and answer. You just need to look at the number. Intubation, chest tube. Okay, that is for you to answer, Dr. Rija. Dr. Hina, Dr. Hiba, you guys aren't replying. Are you still here? Do you understand? Everybody following? Okay. Less than 8 intubate. Write it down. Less than 8 intubate. You don't care what was the GCS before. Less than 8 intubate. How much is your I value for GCS? What's the I value for GCS? Okay, thank you, Dr. Anna. What is the I value for GCS? E4. Okay, great. And for verbal, what's the score for verbal? What's the score for verbal response? 5. Okay, and what's the score for the M is for movement, right? 6. Good, good, good. All right, they're saying what's the most appropriate? You guys are good. You guys are genius. All right, that is great. What's the single most appropriate next course of action? His systolic blood pressure is 86, respiratory is 26, pulse rate is 111. He's got paradoxical respiration with shortness of breath. What do you do? What do you do? 21, RTA, road traffic accident, breathless, severe chest pain, paradoxical respiration, shortness of breath. He's having a blood pressure which is 86, respiration rate 26. What do you do? What do you do? Refer to surgeon, secure venous access, analgesia, chest x-ray. ABC is always the first thing. Dr. Bachchan is very right. You guys are right. High flow oxygen. 88 is not good, never good. Can you tell me what is the concentration of oxygen that you should be looking out for in a COPD patient? In a COPD patient, what is the oxygen saturation? 89, right? 89 or 88 to 92. Dr. Sadia is very precise here. 88 to 92. 89 or 88? 88 or 89? See, the one thing, this one unit is also important. 88 or 89? Dr. Rija says 88. Google it. I can Google it. I do remember it, but it's for you. Do Google it. Right? 88. All right. Okay. Next question. This one says, what's the most appropriate management for this patient? When you notice soot in his mouth, he's having trouble breathing, what do we do? What do we do? What do we do? Kindly turn off your mics if you've just joined in. I apologize, but do turn off your mics. Dr. Galaxy, also tell me who you are. Okay, so what do we do? He's having soot in his mouth. I don't care what happened. Why is he having soot in his mouth? It's not normal. Do you guys have soot in your mouth? No, you don't. Right? Tracheal intubation. That's the first thing. Right? That's the first thing. That's the first thing. Now, when would you go for administration of 100% oxygen by face mask? When you'd go for that in a case of house fire? This is correct though. All right. Airway obstruction, carbon monoxide poisoning, right? That's when you do that. And IPPV, we do that when we're thinking of no other reasons working out. Okay. All right. Okay. So this is for you. Look at the question and answer. You guys have 30 seconds and I'm counting. Or I'll just make you hear the timer. You guys want to hear the timer? I don't know where's my phone. Yeah. 30 seconds to answer this question. That is how you should be doing your questions, even if you're doing Plab1 or anywhere. You should give your guys yourself 30 seconds, have a timer in hand, and practice like that. Practice like you're practicing for your last day of exam. Don't think that you have a lot of time, even if it's 5 months. Think like you just have, when you're studying, you should study like you are having exam tomorrow, right? And don't move ahead. Don't move ahead unless you understand the thing. Right, very important. Do it once, do it right. Okay, I am epinephrine. Epinephrine, EpiPen, very important. Where? Anterior-retrospect to the thigh. How much would we be giving this person? How much would we be giving this person? Okay, 500, however, she's already has IV port. Yeah, even if she has that, we have to give easy access, right? Okay, like, you just feel it, it's very dramatic, you're gonna love that. Once you start doing it, you're gonna love that, right? It's very dramatic. It's like you're gonna be a hero there, right? Like in IV, you'd be like maybe opening the screw and then, like trying to see if it just goes in the line. There, you just take the pen and just push it, right? You act like a hero. You guys have seen those movies. Have you seen the movies? I mean, why don't you guys watch it? You should. I'm sure we're not studying. Let's watch some movies, no? Just kidding, just kidding. Okay. What's the single most appropriate management? Okay, so her hemoglobin is 154. This is very lame, I know, but still I like talking like that. Urea is 4. He has a heart rate of 72, a blood pressure 122/85, a respiratory rate of 14. She denies melena. She's 21-year-old who drank heavily a few hours ago after an evening party. And she has been vomiting repeatedly during the night. 1 hour ago, she vomited blood. What should you do right now? Is she vitally stable? Is she or he vitally stable? First question, is he or she vitally stable? Okay, so should you be giving her vasopressin analog? Yes or no? I don't care if she doesn't have melena. She vomited some blood, right? And she hasn't had any bleeding, so the bleeding stopped. Okay, so please do hear me out first. Do hear me out. Do hear me out. She drank heavily. She drank heavily few hours ago. Few hours ago. Few hours ago. And then she vomited repeatedly during the night. You see here? She vomited. Then 1 hour ago, she had bleeding. Okay? All right, she had bleeding. After that, she hasn't had it. Should you go for cross-matching of the blood? Should you discharge with advice? Should you admit and observe? Should you do endoscopy? Endoscopy? Okay. All right. Should you admit and observe? Should you discharge with advice? Should you do endoscopy? Tell me something. Biliary Sepsis, I hope I'm saying the pronunciation correctly. I really hate it. But does it happen like all of a sudden with one episode, or is there a chronicity to that? What is her hemoglobin concentration? Is she anemic? Is she anemic? Okay. So do you want to go for an endoscopy? Think it through. Even if it's biliary vis, I mean, do you think it's going to just happen one night? And this person is not a woman. Let's just blame the male gender. It's men drinking, not women. Okay. So what do you want to do right now? I've given you all the options, all the possible scenarios. I've confused you to whatever I wanted to confuse you to. Now you tell me, is it 1, 2, 3, 4, 5? What is the answer? 4? Admit and observe. Okay. Now, you're going to work in UK and you're going to have lots of patients there. You're going to have lots of patients there. Do you want to crowd yourself with another patient and you'd be checking on them and observing them? You wouldn't do endoscopy. Dr. Sheila wouldn't do endoscopy. She's like, I'm not interested. 21-year-old should be responsible, should not be drinking. Why should I be doing endoscopy? Okay, we're not doing endoscopy. Do you want to admit and observe? You're going to admit and observe. Think about it. You've got 20 patients on the bay and you're putting one more person to observe and admit just because they were very careless. They drank a lot, they vomited a lot, and because of that vomited, they eventually got a tear and they got blood, but now they're not bleeding. You want to admit and observe? It's your choice. Should I go for 4? All right, you guys said that. I didn't. I don't know. I don't know. Okay, no, yes, let's see. Let's see what is the answer. Discharge with advice. This man has Mallory waste hairs, right? He does. He does. He might. This is very high yield. You need to remember this. You know, they have took this exactly from Plab1. Repeat your FBC, full blood count. Observe vital signs for deterioration. This is a low risk patient. Discharge would be appropriate. You don't have to admit and observe unless they were having deteriorated vitals, right? Which they did not. Okay, Claire? All right, next question. Next question. Let's try and do 50 questions. I think we can. We're almost there. We're almost there. Okay. Questions where you have your labs. Before doing anything, sort them out. That's what works for me. I'm not sure what works for you. So PT is high, right? GGT is high. ALK-Phos is high. Aspartate transaminase is really, really high, higher than what you saw here. Alanine transaminase is 1180. My question is, if it is alcoholic, what should be high? AST or ALT? Google it. Google it. ALT, AST, GGT. If it was something related to alcohol, if it was alcoholic hepatitis, or you know that thing that is associated with alcohol, should AST be more than ALT or GGT? Okay, you guys said it. I'm not. It's for you. I'm not going to clear that. It's for you. Please Google it. See what it is. Understand it. Remember it. It's on you, right? This is no spoon feeding. This is for you to remember things because all of you are doctors. You've done your medicine. I know you've forgotten it. Might have took time and we're coming back to it, but Google it because the more you work, the better it gets, right? Okay, 27-year-old male visits the emergency department with complaint of 24-hour epigastric pain, hematemesis, and he said that he's been taken unidentified drug 4 days ago, but he can't remember the direct names the drug. And he assumed he's consuming alcohol occasionally. A big question, right? Okay, here. What is the medication that he took? What's the medication that he took? He has a pulse of 129, a blood pressure 1560. Is he stable vitally? Is he vitally stable? Yes or no? They're vitally stable. As soon as you look at these numbers, just see if they're vitally stable. They're vitally stable, all right? They're vitally stable. The second thing is everything in here is deteriorated. Seems like the drug has been working on the liver, right? It affects the liver. In your Plab1 exam, you're going to have 3 drugs that affect the liver mostly, and you would have 3 drugs where you would have your LFTs arranged. Number 1, paracetamol. Number 2, aspirin. Number 3, lithium. In aspirin, you would have your tinnitus, right? In lithium, you would have a history of, a previous, problem of psychiatric origin. In paracetamol, you would not know the consummation, but the person would consume it with alcohol. Maybe, most likely. So which drug do you think it is? Organophosphate, venlafaxine, paracetamol, aspirin, amitriptyline. Is he having tinnitus? Let's see. No, he has hematemesis, and he complains of 24-hour epigastric pain, quantity of drug that he took when he was drunk, right? So what do you think it is? Yes, over the counter, not prescribed to him. It's easily available. You guys say paracetamol? I don't say it. You are saying it. It's on you, not me. I want to come clean, even if you guys get it wrong. You guys are right, though. All right, it's paracetamol. Okay, all right. Now, if you want to read the description, you can. This says a paracetamol is an antibiotic analgesic. 24 hours hepatic necrosis begins to develop and may progress to acute liver failure. Routine liver function tests will not detect the liver damage until 18 hours have transferred, and all the things are happening, so you know how it is. Okay, next question. In aspirin, you would have nausea, ringing in ears, right? Ringing in ears. Amitriptyline is TCA, and a person would be having, tachycardia, sweat, and dilated pupils, but you would be diagnosed with a condition to have had TCA, which is amitriptyline in your house, or an older person, right? It would be mostly a grandma having it and a nephew or a grandchild consuming a TCA. Okay. This one says, what's the single most appropriate management? There's a 33-year-old rescued from the building. Are they vitally stable? Are they vitally stable? Are you guys still there? Can you hear me? Are they vitally stable? See, you don't have to read the whole thing, right? If you want to, you should, because you're having your exam for sure. But if you want to save time, it's not like I'm putting you and giving you a bad headache, a bad habit. What I'm trying to say here is try to look at the numbers first, right? Look at the numbers. Try and get that in your head. First thing, she is not vitally stable. Second thing, house fire. Third thing, unconscious. Should she get a tight fitting mask with 100% oxygen? Should we administer sodium bicarb? Should we give 24% oxygen by face mask? Should we put her in a hyperbaric chamber? Should we intubate and provide IPPM on 100% oxygen? First thing, 24% oxygen by face mask. Where is that used? Where is that used? Okay, where is 24% oxygen used in your Plab1 scenarios? COPD, right? COPD. Otherwise, if it's a normal person, we would not make a fancy oxygen concentration for them, right? It's fancy, isn't it? 24% fancy for people who have COPD. It's not good to have it, but they're getting special oxygen, right? So option 3 is gone. Thirdly, fourth option says tight fit and mask, but this person's unconscious, right? Nothing of the sorts would happen to him in here. Hyperbaric oxygen chamber, first of all, they're very expensive. It takes time to, arrange that. All right. So fifth is there, kind of hanging in the balance. Sodium bicarb. When do you administer sodium bicarb? When do you administer sodium bicarb? What do you use it for? Acidosis? Okay. All right. Acidosis. You guys are saying acidosis. So are we worried about the acidosis right now? What are we worried about? Him being unconscious. What do you think you should do? What do you think you should do? Okay, you are saying it. I'm not. I'm not. Dr. Nagma says 1. It's good that she's sticking with her answer. So what we're going to do is we're going to go for that. Should we go for 1 or 2? I hope I'm saying the correct name. Dr. Nagma, right? I know it's killing you that I chose 1. Because the patient's unconscious, not this, Dr. Nagma, we're not going to go for sodium bicarb. This is definitely a treatment, but first we need to take care of their unconsciousness. Why are they unconscious? Right? That's the first thing. The patient is unconscious. We need to intubate, provide IPPV, oxygen, use a tight fitting mask with oxygen reservoir for conscious person. Bookmark. They're saying bookmark in biomed revisions, but I'm disappointed that they didn't give us an easy access to the cardio thingy. Right? I was putting emergency for the very end. Okay, so we'd do 50 questions today, just 50. Let's see where we are. We'd get there. We're halfway there. All right. This one says, what's the single most appropriate next step in the management? Right? What is IPPM? Yes, what is IPPM, guys? Dr. Haskam says, what is IPPM? That's a good question. Let's see if your colleagues know. Yes, what's IPPM? Anybody knows what's IPPM? Do you want to do the honors of Googling it? If you don't know, I'm going to tell it to you, but I want to know what you know. Dr. Samir has took the guts to write it. Intermittent positive pressure ventilation. Dr. Hina has done it too. Intermittent positive pressure ventilation. Right? Intermittent positive pressure ventilation. That means you would be ventilating them by lots of pressure, trying to put an oxygen against the pressure of whatever is inside. Yeah? All right, Dr. Askam, is it clear? Okay? All right. Next question. This person has come in and they're saying, what do we do next? The pain is not eased by elevation of the testes. On examination, the right testis looks normal, but the left testis hemiscrotum is swollen and acutely tender. 3 hours ago, he had severe left ventricular, left testicular pain, 15-year-old. What should you do? What should you do? Reassure. That's the best thing you can do. Do you want to reassure him? Go for a urethral swab. Go for a CT scan because that's the best thing. Are you guys sure? Why not an ultrasound? That seems good. Less invasive, no? Sudden onset of pain. Sudden, I know it kills you, right? I like annoying you people. All right, exploratory surgery. Okay, exploratory surgery is having testicular torsion. Okay, nothing else. Testicular torsion. Simple as that. Okay, this is for you because we did do it. Look at the heart rate and answer. 133. 133. The heart rate is 133. 133. Is it above 140? Okay. All right. If the heart rate was, let's say, 98, how much blood should this person have lost in percentage and in volume? No, no, no. If the heart rate was 98, okay, Dr. Sami is very precise, but all right. Okay, less than 15%. And in volume, how much? I'm saying it again. In volume, how much? In volume, how much? 750. All right, 750. Here's the thing. If the heart rate is not tachycardic, right? Tachycardia is above 100. If it's less than tachycardic, a tachycardic heart rate, then we're thinking 15% blood loss, 750 ml, right? 15% blood loss, 750 ml. If the heart rate is tachycardic, but below 120, the blood loss is how much in percentage? Guys, I'm doing this because you would remember and you would type it. It's important you type it, right? Or maybe write it down. No. Here's the thing. Tachycardic, but below 120, 15 to 30%, 15 to 30%, 15 to 30%. You're not able to hear me, Doctor? Can you guys not hear me? Do you hear me properly? Okay, I don't know why that happens. Right, okay. So what I was saying if the heart rate is below 120, above 100, blood loss 15 to 30%, 15 to 30%. How much in volume? How much in volume? Definitely above 170 or 750. And 1500 to 3000. Come on, don't do that. 40% blood loss is 2 liters. 3000 is 3 liters. So I'm saying 15 to 30%. It's 750 to 1500, most likely, I guess, right? Okay, 750 to 1500, which is 750 ml and 1.5 liters. All right. Now, if the blood loss or the heart rate is above 140, how much percentage of blood did she lose in liters and in percentage? If it was above 140, heart rate above 140, more than 40%, 2 liters, mostly 2 liters. All right. So this is heart rate, which is above 120, but below 140. How much blood did she lose? How much blood did she lose? 30 to 40%. Right? Do you guys remember this? Am I making sense? Have I confused you? I hope not. If anybody's confused, you can even inbox me on WhatsApp if you're shy here. Okay? Don't worry, I'd repeat it. All right? Clear? Everybody clear? Dr. Bachchan, Dr. Hiba, Dr. Hina, Dr. Haskam. Do you hear me? All right, you want me to repeat it? All right, here's the thing, Dr. Maria. If the heart rate is above 100, right, is below 100, the blood loss is 15%, because 100 is not tachycardia, it's almost normal, right? Almost normal. If the heart rate is 100, below 100, the blood loss is 15% or 750. If the heart rate is above 100 but below 120, the blood loss is 15 to 30%. I hope I'm saying this right then, right? And if the heart rate is above 120, the blood loss is 30 to 40%. If the heart rate is above 140, then the blood loss is 40%, right? Okay, what I want you to do is I want you to Google what blood loss in percentage, right? Blood loss in percentage. Okay, Dr. Hina, I did repeat it. Did you get it? Do you understand? Okay, don't worry, with repetition, you would remember. Don't worry, with repetition, you would remember. Okay, we'd do that. All right. Okay, now here, look at the numbers. 656. 6 is the respiratory rate. What should you do? Unconscious and elevate. Respiratory rate is 6. Concentrated pupils. Constricted pupils. Constricted pupils. What should you do? Opioid, naloxone, be fast, have tiger-like or lion-like reflexes. Right? You guys understood? Did you follow it? Did you read it? All of you read it? Did you guys read it? Did you guys get the time to read it? Elevate is definitely something you should look at, but look at the number. 656. 6 is the heart respiratory rate, 56 is the pulse. I don't care about the pulse. I'm looking at the respiratory rate. It's 6. I need to save this person. I'm in the emergency. I would give him naloxone. Right? Right? Okay, good. All right. What's the most appropriate initial investigation? Initial investigation. Now, this is really important. Really important. I'm going to read this. You have to remember this, and I'll give you a trick to remember this, right? And this is also important for your Plab2s because you're going to have your exam of Plab2 and you would be working in your emergency, and you're also working right now in your country. So you should be serving your people by remembering this. All right. Okay. Let's see if he needs a CT. After a motorcycle crash, a 33-year-old male presents to the emergency around the left orbital region. The person has bruises. What is this thing called? Orbital bruise. What's the name of that? Raccoon eye? Isn't it? Raccoon eye. If it was around the ear near the mastoid, Bettel's sign. Right? Bettel's sign. What does that show? What does that signify? Basal skull fracture. Basal skull fractures are to be taken seriously. Right? You need to remember this for your Plab2s as well. This is essentially important. I'm training you for your Plab2 right now because then they're not going to test your knowledge. They'll test how do you say things, right? So we're just preparing you for that as well. His GCS is 14 on initial assessment. On examination, it's noted that the patient has consumed alcohol. We don't care. I don't care. I want to see if he needs a CT. His GCS drops to 8 within 2 hours. What do? Here it's crystal clear. He needs a CT, right? He needs a CT. Chest X-ray, not important. Angiogram, not important. CT is something that he needs. Now we need to remember the criteria. Okay, we need to remember the criteria. Now I tell you how to remember the criteria. Okay, let's remember the criteria. Okay, here is the thing. Here is the thing. Where is it? Okay, now I'm not in CNS yet, but what does this look like? Is this a brain? Does it look like an expanding lemon? I mean, this thing over here, does it look like an expanding lemon? No? Yes? Is it subarachnoid hemorrhage? Is it epidural hemorrhage? Dr. Haskam, are you following? See, expanding lemon is epidural hemorrhage. This person would have lucid intervals, right? Epidural hemorrhage, lucid intervals, right? Lucid intervals. This one This one, what is it? What is this one? Okay, this one over here, over here. You see the hemorrhage is over there. There is midline shift. This is subdural, right? Crescent shaped. This is, they call it funny banana. I'm not sure why do they call it that. Banana or banana, whatever works for you. I don't know. I've messed up pronunciations, but here I am still. Right. Now, in adults, you have two criteria to get the head CT. Really important you remember this. Absolutely important you remember this. If you see an adult, right, and their GCS is less than 13 on initial assessment, get a CT immediately. Get a CT immediately. If the GCS is less than 15 at 2 hours post-injury, not while he was in the emergency or when you saw him and took it in the emergency, but time duration post-injury, right? Like on initial post-injury, it is less than 15. Get a CT scan immediately. If there is an open or depressed skull fracture, get a CT scan immediately. If there are basal skull fracture signs, get a CT scan immediately. Post-traumatic seizure, get a CT scan immediately. Focal neurological deficit, get a CT scan immediately. More than one episode of vomiting, get a CT scan immediately. I'm going to make you remember this, hopefully, right? Hopefully, not sure, but I try to make you remember this, all right? So here's the thing. Here's the thing. Here's the thing. When should you get a CT scan immediately? Number one, on initial assessment, GCS is 13. Secondly, if you saw them within 2 hours post-injury and the CT scan and the GCS is 15, get a CT scan. If they're having a skull fracture, because of skull fracture, they have a neurological deficit, then a fit. This is how you'd remember that. Skull fracture, neurological deficit, a fit, get a CT scan. One episode of vomiting, more than one episode of vomiting, not just one, more than one, get a CT scan immediately, right? Nothing combined. Now, when do you get within 8 hours a CT scan? If a person has LOC and amnesia, you understand? LOC and amnesia. If they have LOC or amnesia, either they had a loss of consciousness. In the previous criteria, do we have loss of consciousness or amnesia? No, we don't. We don't, right? We just see some things. We see a fit, we see a deficit, we see more than one episode of vomiting, we see a depressed skull fracture, we see a basal skull fracture, we go for immediate CT scan. In the second criteria, you should either be unconscious, right? Or you should have amnesia. Along with that, you should have a bleeding or clotting disorder, right? Along with that, you should have more than 30 minutes of retrograde amnesia, right? Along with the loss of consciousness or amnesia, you should be more than 65 years of age or have bleeding disorders. You guys understand what I'm trying to say? Do you guys understand what I'm trying to say? It's really important that you remember this. Do you remember this now? Somehow, should we repeat it? See, on initial assessment, GCS less than 13, right? Less than 13. Post-injury, less than 15. A skull fracture, basal skull fracture, because of that you developed a fit, neurological deficit, vomited, immediate CT scan. If you had loss of consciousness, amnesia, you were very old, you were taking some drugs, right? Because you had clotting disorders, or you had a dangerous mechanism of injury, right? Like previously, doctor has come asked whether we should have a seat belt. For example, they were not having a seat belt and they ejected from the motor vehicle, right? And that's when you should definitely, and then they developed amnesia, get a CT scan within 8 hours, right? If they had retrograde amnesia along with the loss of consciousness, right, go for a CT scan within 8 hours, right? Claire, should we move to the next question? Do you guys need a break? Okay, what question are we at? Okay, let's see if we can do the next question first. Okay, great. Right, we're almost there. I'm hoping you guys are not tired. Are you guys tired? I'm hoping you aren't, because I'm working on 2 hours of sleep today, right? I need to show it off, right? Okay, I'm going to be sick tomorrow, but it works, right? Okay, you guys have 30 seconds to do this. I'm starting the timer. You guys have 30 seconds to do this. First of all, you should be saying mashallah. And secondly, You guys have 30 seconds to answer this. I'm giving you 30 seconds. I'm giving you 30 seconds. You're going to hear the beep. Dr. Sheila says 3. Dr. Bachchan says 333. I'm gonna go for it, but still. Yes, I need everybody to answer. Dr. Hamza says 3. Dr. Anna says 3. Behram says 3. This is what 30 seconds is, right? So let's see. Unknown dose of paracetamol. You saw that, you definitely are going for this, right? Read the last sentence, read the first sentence. Almost always try and do that, right? Okay, N-acetylcysteine. That is correct. That is correct, right? Okay, when do you do a gastric lavage? Okay, all right. Now this is again for you guys, right? You guys have 30 seconds. Let's see if you can get an answer for this. Yes. 5, 4, 3, 2, 1. Is it annoying? It's supposed to be. All right. Okay. You guys are saying, Dr. Zoya is saying 1, and the rest of you guys are saying 3. Dr. Bachchan says need IVF if more than 10% burns. Okay. You need to remember this. Okay. She's 18 months old, and we don't care how it happened, but it's a partial thickness burn, and it's 6% on the chest. What is the criteria in children to get IV treatment? How much should be the concentration of burn or the percentage of burn when you should treat them? What should be the percentage of burn when you should treat them? 10%, right? That's what you guys say. In adults, what about adults? What about adults? What about adults? 15, you guys sure? Okay, all right, that's what you were saying. That's what you were saying. Okay, all right. Now, you know, even if she had 9% burn, would you be treating her with IV fluids? Why are we looking at the percentage? Because we are estimating the blood loss. This person is the emergency, right? We're estimating the blood loss. We're seeing what's our next course of action. Should we give IV albumin infusion? Dextrose? Crystalloids? Colloids? No, no treatment, no IV treatment, less than how much she has lost, right? Most likely she doesn't need treatment. That's what you guys said. I didn't. Did you guys say it? I didn't say it. You said it, right? This is correct. Any child more than 10% fluid replacement, not no fluid replacement, no fluid replacement. All right, no fluid replacement. Okay. Now this formula is also really important. You might have 1 or 2 questions. For quilts, what are quilts? Adults, right? I know what quilts are. Quilts are the comfort. Okay, you're saying adults, right? Yeah. For adults, how much do you think it is? Dr. Bachchan says 15%. Do you guys agree with Dr. Bachchan? The rest of you guys? It's written over here. Okay. When do you go for resuscitation? 15% adults, 10% children. Okay. All right. All right. Very important you remember this. Then what you do, you would shift them to emergency. You would maybe decompress or not, depending on how much they've lost. And 4 ml into surface area, body weight in kg. Please do remember this, not in pounds, in kgs. Even if you're going to the UK, it's in kg. You go for crystalloids only, all right? Okay. Deduct fluids should be given, resuscitation should be done, all right? And you should monitor them. You should give them colloid infusion at the rate of 0.5. Okay, and maintenance colloid is given at 1.5 ml. Take a screenshot if you want. This is kind of important. You might have 1 or 2 questions, maybe 1 questions occasionally. I haven't seen it so far in the previous exams, but you might have it. So take a screenshot if you need. Otherwise, we're moving to the next question. Is it interesting? Do you guys understand our following? Okay, so again, this one, you guys have 30 seconds to answer this. All right, 30 seconds to answer this. Which is the most appropriate initial management? Now, I'm not going to give you 30, I'm going to give you 20 seconds. Let's see if you can handle that pressure. This was 20 seconds. Did anybody get it right? Okay. Dr. Nagma says to you guys are saying too. Let's see. So, which is the most appropriate initial management? Emergency department doctor believes that the attack, his liver has damaged and calls surgeon to assess him. Now, during an argument, a person was stabbed with a small knife. Look at his vitals. Is he stable vitally? Is he vitally stable? Okay. All right, that's good. But I want to see, is he vitally stable? He's not. Should you go for a CT? Should you go for an X-ray? Should you go for a cross match? Should you go for an FFP or should you go for a laparotomy? What is the single most appropriate initial management? Has he lost blood? Do you think he's lost blood? Do you think he's lost blood? Do you think he's lost blood? If he's lost blood and we're giving him IV fluids, you know he's on IV fluids. Still his BP is low. His temperature is low. He's not vitally stable. What should you do? Surgeon, immediate laparotomy, or stabilize him? You know, when you go for laparotomy, you're cutting open his abdomen. More. You're gonna cut open his abdomen. That puts the body in stress. You lose more blood. What should you do first? What should you do first? We're giving him IV fluids. What should you do first? Think about it. You are dealing with a person who's 26 years old. If he dies, it's on you. Okay, do you feel the pressure? Do you feel the responsibility now? Do you understand what you were supposed to do right now? The ones who said surgeon earlier, do you think you should be going for immediate laparotomy? Or should you go for cross-matching or CT? Cross-match? That's what you guys are saying. Cross-match, right? First cross-match. Cross-match for pec red cells. He's taken IV fluids, not working out. All right, let's see if that is true. That is correct, right? That is correct. Okay, that is correct. This is the last step. You need to read the question carefully. It says, what's the most initial management? Yes, that's the most appropriate, but their question is initial management, right? Their question is initial management. Okay, next question. All right, we're almost there. Okay, right. So this is for you guys. Again, I'm going to give you 20 seconds. One trick is that the one with the most words is almost always the right answer. But let's see if you guys get the answer. I'm giving you 20 seconds for this. Dr. Bashan has opted for the option with lots of words. All of you have almost. Which is the longest stem in here? Okay, that was 20 seconds. Which is the longest stem in here? 3. Okay, that is. And that is true, right? Turn the infant into prone. Yeah, that is one of the tricks that I've learned. It's almost always true for any exam if you don't know the answer, right? 5 sharp blows with the heel of the hand to the middle of the back, not on the face, right? On the middle of the back, right? If that's your own child, okay? If that's your own child, you would definitely care. Okay, not on the face. All right, otherwise you're going to the jail. Just kidding. Just kidding. This was lame, Dr. Hamza. I apologize. I should stop. Okay, turn the infant into a prone position and give 5 sharp blows with the heel of the hand to the middle of the back. All right, to the middle of the back. Okay. Okay, right. All right. Okay, okay. Again, you guys have 20 seconds. I'm sure you guys are following. Dr. Haskam, everybody else, you guys following? Is it better this way? Or should we be explaining things? Whatever works for you though. Okay, do read the question out. I'm going to read it too, but you need to read it. You need to read it. This one says, yes. Okay, let's see if all my candidates are here and listening. Okay. Just checking if you guys are still there. All right, good. So this one says, what is the most appropriate course of action? There is evidence of ulnar fracture. The patient cannot move his fingers, complains they are numb. This person had crush injury, numbness. What do you think has happened? Cannot move his fingers. What has happened? Okay, discharge and review in fracture clinic. How about that? You know, we're like the cool doctors. We're like somebody else handle it. Why should I? I do two. Do you guys want me to go for 2 or 1? Compartment, is it killing you? I hope it does. I hope it can, because you know it's annoying, right? When you know the answer and the other person doesn't. We can't discharge. I discharge them. It's compartment syndrome, right? Just kidding. You're not supposed to discharge them. All right. You're gonna go for compartment and you're going to release the pressure, which would require fasciotomy, and then the person will be able to move their hands, and you know there will be a reflow of blood in there. Okay. All right. So again, 20 seconds. What is the answer? What is the answer? 20 seconds. I hope nobody's confused. Dr. Haskam, Dr. Hamza, Dr. Bachchan, Dr. Samir, Dr. Sheila, Dr. Zoya, Dr. Baram, Dr. Hina, Dr. Hiba. You guys following? Everything clear? Dr. Nagma, Dr. Safana. Clear? Things clear? You understand? Following? Okay, 20 seconds are up. Dr. Haskam, I don't see you replying. Okay. All right. Are you there? Good. Good. Okay. Is it scrotal abscess? All right. Dr. Anna says 1. Now, lifting testes causes more pain. I hope I'm saying the right word. I forgot the pronunciation. Examination reveals a very tender mass in the right scrotum with reddening of the scrotal skin. Developed acute pain while playing football. 14-year-old young person, young boy actually, playing football, all of a sudden develops pain. When you touch it, it's painful. It is definitely tender. What do you think it is? Epididymoorchitis? It is more of an infection associated with a sexual activity. He didn't have it, right? Even though there 14 years is fine. Okay. Scrotal abscess. No abscess. Abscess will not cause pain when you move it, right? Okay. Testicular tumor. Young person could have it. I mean, it is kind of there, but why would it be painful? You know, the thing about cancer is that it is not painful. This is why they say pain is bliss, right? Because when you are in the most pain, right, you want to move, right? You make changes, you take decisions, right? Okay. So good. Pain is good. Pain is good, right? That is blissful. Okay. So this is your testicular torsion. You got the answer right. Okay. Right. Again, I guess it's one of the questions and the scenarios that you like. You guys have 20 seconds for this. The timer starts now. PCE 100, 300. PCE 100, 300 doesn't fall in that criteria. pH 7.3, isn't it? Isn't it? Do you guys follow? Do you remember? Have you wrote it? Please write it. PCE 100, 300. If the prothrombin was 100, if the creatinine was 300, if they were just not lethargic or confused, but they were, you know, shouting obscenities, if they were calling you names, definitely go for liver transplant based on that. But the pH is also 7.1, right? Like you can start reading from above, but it would waste your time. Go from down above, right? This is also the trick if you were taking MLEs, right? Step 1, step 2, that's how they treat you. That's how they teach you. Go from down above, right? Because they give you the information at the very ending time. Isolated dose is sufficient criteria to go for transplantation. That's true, Dr. Bachchan, but that's very fancy, right? How about we say pH of less than 7.3? Okay, that is a good word in though. Dr. Haskam, Dr. Zoya, Dr. Hiba, Dr. Bahram, you guys are following? Do you understand? Right? PCE 100, 300, meaning prothrombin time should be 100, creatinine should be more than 300, and they should be having grade 3, you know, encephalopathy. That's when you'd be extending that alone as a criteria. Okay. What should be the appropriate management? 45, chronic alcoholic, stopped drinking 2 days ago. When do you give fluoridized epoxide? When do you give fluoridized epoxide? I want all of you to answer. Otherwise, I would not be allowing you in next meeting. I mean it. If I'm taking your name, I want you there. Right? I want you to answer, even if you get it wrong. Even if you get it wrong. Because, you know, otherwise you could just do it on your own. What's the reason that we're doing it? I don't like talking. I mean, I do, but I don't like wasting my time and talking to people who wouldn't reply. I hope I'm not being rude, though I am. So please tell me, what's the answer here? No worries if you're confused. No worries if you're confused. You need to write it down, right? How else am I supposed to know if you're confused or not? How am I supposed to know then? No? Why would you pay me then? I mean, you've given a petty amount for the time I talk, but still, right? Okay, it's kind of fun teaching. Okay, here's the thing. Here's the thing. Here's the thing. This person is chronic alcoholic, right? 2 days ago, he stopped drinking. What do you think you should manage first? What do you think you should manage first? When do you give echem-prostate? When do you give echem-prostate? I'm here to confuse you for sure, but also to give you answer. When do you give echem-prostate? Withdrawal. When do you give disulfiram? Disulfiram for craven or echem-prostate for craven? Echem-prostate is for craven or not? Echem-prostate is for craven, right? You guys agree? You guys agree? Right? Disulfiram for? Disulfiram for? Okay, disulfiram for? Dr. Hina, please write these things down. That's all right. That's all right. If you don't know this one, what they are saying, what I'm saying, please type these down and write it. That's how you learn. If you don't involve yourself, you wouldn't learn, right? Okay. I hope I'm not being mean or rude. I'm just telling you how you'd run, how you'd remember things, right? Write these things down. Whatever I'm saying, the points that I make, type it, write down and send it, right? This way you learn and you also repeat and tell it to others, right? If you share it, you help yourself, you help others, right? Okay. So echem-prostate for craven, write it down and type it and send it here. Echem-prostate for craven, disulfiram for? Yes, guys, disulfiram for? Disulfiram for what? Deterrent. Chloridized epoxide. When do you give chloridized epoxide? When do you give chloridized epoxide? Withdrawal. All right. So what should you do here? Thiamine or chloridized epoxide? What do you do first? Thiamine or chloridized epoxide? In reality, you would be doing both the things together, but here, what should you do first? You guys have said it. I haven't. I haven't. You guys are saying chloridized epoxide because you're thinking you'd get withdrawal. Let's see if that is true. That is correct. That is correct. That is correct, right? Thiamine is necessary, but first thing is to stop him from getting those withdrawals, right? Stopping from getting those withdrawals, right? Stopping from getting those withdrawals. Okay. Okay, clear? Please take a screenshot if you want. Otherwise, I'm hoping this is clear. Okay, let's move to the next question. To prevent vernix, very right. B1 deficiency, true. Dr. Hina, do you understand? Are you following? Okay. Are you there? Okay. All right. Okay, this is question number 36. We're almost there. All right. Great. So what's the single most likely drug responsible for this patient's symptoms? It's on you. You guys take it. No worries. No worries. If it takes time, that's all right. I'm here. I'm here. I'm listening. Okay. It's all right. It's for your learning. Okay. What is happening to this patient? Ecstasy, hyperthermia or not? Ecstasy, hyperthermia or not? Okay. All right. All right. Now, I think, no, here's a suggestion. Here's a suggestion. If you ever get a pet, name them Lsd, right? Name them Lsd. Why? Because, they'd be looking at you with those googly eyes, right? Okay, with the googly eyes. Name them Lsd. It's a cute name, no? Get a pet, get a parrot, or if you have house rats, or if you have cockroaches, right? Name them Lsd. Okay, because they look at you, they need to dilate their pupils. That is your Lsd. Sorry, yeah? Is that no? Okay, is that a yes or no? So what is this? Is this Lsd or is it ecstasy? What is this condition? This person's 21. They went to a party. I mean, going to party, they're kind of fun people. That's what they say. I don't know. I don't go. She has been staring at the hospital wall, stares at the clock is moving around. She's having hallucinations. On examination, you notice tremors and dilated pupils. She can see colors when she closes her eyes. Elevated senses, right? Like they're in out of the world situation. Lsd. Next time you look at your pet, if you see a dog or a cat, or if like even if your sister looks at you when you are counting your celery, or your friend or your wife or whoever that is, your spouse, then you should name them Lsd. Because their eyes dilate. They're excited. Name them Lsd. That's how you'd remember it. Well, let's see if that is true. That is correct. Okay, you guys remember it now? Understood? Okay, next question. I'm hoping you guys follow. I know this is lame way of remembering, but I hope this makes sense. Okay. What's the most appropriate advice regarding CPR for their child? Go. 7 months old. What should you tell them? You know the answer. How many rescue breaths should they get? 2, 3, 5. Can you guys hear me? 2, 3, 5. How many rescue breaths should they get? 2 rescue breaths? 5. Not the ratio. 5 rescue breaths. Right? 5 rescue breaths. Right? 5 rescue breaths. That's good. That's good. Yes, Dr. Hina, how many rescue breaths? Are you still there? 5. Also here, index and middle finger. Answer is also 5. And rescue breaths are 5. Here we're going to go for index and middle finger. Right? How many rescue, what is it, chest compression to rescue breaths ratio if a parent is doing it? That's all right, Dr. Hina. Okay. How much is the ratio for compression? 15:2 or 32? Okay, forget about that. All right. If it's a pediatrician doing it, what's the ratio? Okay, you guys are still confused. Here, just remember this. If parents ask, do you want to burden them or not? If parents are asking, do you want to burden them or not? Parents ask. Yeah, I know you are. This is why I'm saying it. Parents ask, do you want to burden them or not? I mean, you should burden your parents, but if somebody else says it, and if somebody else comes in, don't burden them, right? Burden your parents, and we are burdened on our parents already. I know, because I annoy them a lot. I'm not sure about you, and I don't know how my children are going to be with me. But for now, don't put burden on the parents. If that is so, give them an advice of going for CPR 15:2. Clear? Clear? Is that clear? Do you understand? Right, parents? Now, if there is one rescuer, right? One rescuer, meaning a trained physician, a trained pediatrician, 30:2. Okay? Clear? Right? Okay, understood? Understood? Clear? Just for the sake of exam, we're doing it. So right now the answer is 5. That's what you said. That's what you said. That's what you said. Okay, remember that both answers, 5 and 2, are in the right terms of the best advice to give to them, but it depends on who is doing what, right? Okay, so here they've changed it to 32. However, I'm going to recommend you, if you have questions like that, go for 15:2. Again, please correlate this with Plab1-Emergency, right? Parents 52, pediatrician 32. Again, depends on how many people are there, right? So don't worry. Please do correlate with Plab1-Emergency and see what works for you. But my advice would be pediatrician 32, because that's a lone person, that's a trained person, they can do it. Parents would be confused because they're looking at their child going through like loss of vitality, gasping for breaths, and if you tell them to do 32, they'll forget it, right? So 15:2 is more easy to remember and perform, isn't it? And keep track of. Okay, right. What is a single? Yes, that's right, Dr. Anna. Okay, what's the single most appropriate management? RTA. Initially it was 13. Initially the GCS was 13. Right now it's 9. Respiratory rate is 30/48. What should you do? X-ray? I'll go for X-ray. That sounds fun. Like portable X-rays, I rarely see them. IV fluids, thoracentesis, IV hydrocortisone. X-ray, should I go to X-ray? Airway first? Okay, you guys are using your caps. I know you're shouting at me first, talking lame. Right, oxygen. One thing, first thing, oxygen. Oxygen. ABC. Dr. Anna is very right. ABC, initial management oxygen. Very important. Right, next question. Dr. Barham, are you following? Are you still there? Okay, all right, we're gonna end it at 40. Should we end it at 40, please? Okay, or do you want to do 10 more? Let's see if we can do that through. See that through. All right. Okay, this is again for you. What's the most likely diagnosis? What's the most likely diagnosis? 10 more for sure. Okay, what's the most likely diagnosis? Let's see if we can do it, right? It's on you, not on me. It is though, but still. Read from down above. Is she vitally stable? Is she vitally stable? I don't care what you see. Is she vitally stable? 2 or 5? Okay. Is she vitally stable? Blood pressure. Look at the blood pressure. Look at the blood pressure. Okay. Okay. Fever, blood pressure. Okay. Can we call it septic shock? Can we call it septic shock? Yes, that's a good question. That's a good question, Dr. Anna. How do we differentiate between sepsis and septic shock? So you guys tell me, how do we differentiate between septic and septic shock? Okay, you tell me, how do we differentiate? Unless you give them challenge of fluid, you cannot call it shock, septic shock, essentially. right? More importantly, unless you give them fluid challenge, you cannot call it septic shock. That is a criteria, isn't it? Isn't it? Isn't it? Didn't we do it in previous questions? Right? Unless you give them a fluid challenge, it is not a septic shock. Did they give them fluid challenge? Right? They did not. They did not. Right? They did not. So what do we do here? Sepsis, septic shock, cirrhosis, eclampsia. You're going to answer. I'm not. I'm here to confuse and give you all the information. It's your choice. Do you want me to go for 2 or 5? Or do you want me to go for upper RTI, upper UTI, eclampsia, or cirrhosis? First of all, she's 61. I mean, all right. If she's from Pakistan or India and she's strong enough to deal with men and have like 10 children, she might have eclampsia at this age, but it is unlikely if she's in UK, right? So unlikely to have eclampsia at that age. So 3 is gone. That is not the option, right? Okay, all right. I didn't mean it in an obscene way. Okay, what I meant was that she's been handling, right? Okay, right. Cirrhosis, unlikely, right? Okay, in cirrhosis, you don't have a temperature. Okay, yeah, don't die laughing. I'm still here. Is it cirrhosis? No flu challenge as mentioned. You guys tell me, you're going to answer. I don't know. You tell me what's the answer. Last thing. Okay. Cirrhosis, no. Eclampsia, no. Upper respiratory tract infection, no. What is it? Dr. Button is like, it's biliary cirrhosis. Ma'am, why don't you go for it? Okay, it's biliary sepsis. All right, Dr. Button, I went for it. No need to open the caps. I'm scared of caps. That is true. That is true. Right, see, it says clearly, since she has never been given IV fluids, we cannot say it's septic shock. Unless we see the response to it, it's not septic shock. All right, guys, you follow? All right. Okay. You guys are ready to go into the NHS. Why do you want to work there anyway? They'll treat you like, I mean, I'm going, so who am I to, I'm not one to talk. But this is a bypass. Okay, let's see how it works. What's the single most appropriate I would be needing your prayers? All right, this one says, what's the single most appropriate next step in management? On examination, the testis is tender on palpation. He is afebrile, 16-year-old, woken up from sleep with severe sudden pain in testis. What is it? Reassure and ask him to go back to sleep. Discharge with analgesia. Increase the dosage of analgesics and discharge. Urethral swab. Reassure. Dr. Hasma, are you sure? Yes. Should we reassure? Should we go to the surgeon? Unless you don't like the 16-year-old boy, I think you should send him to the surgeon. No? All right. Refer to the surgeon. All right. Refer to the surgeon. It's testicular torsion, nothing else. Let's move to the next question. Okay. All right. Yes, I did. Okay. What's the single most appropriate immediate action? 64 amitriptyline overdose. Amitriptyline overdose. Right? What do you do next? What is amitriptyline? What is amitriptyline? What is it? What is amitriptyline? TCA. Okay. What would you see in the ECG? If you're ordering the ECG, what would you see? Ventricular arrhythmia? Right? It causes arrhythmia. It causes arrhythmia. Protection of the heart is the first thing. Right? In all case scenarios. Okay? Electrocardiogram. All right? ECG. Prolonged PR. Broad complex tachycardia. You know, it's going to show you what? It's going to show you what? It's going to show you the ghosts. Okay? When you overdose with the TCA, you see ghosts in the ECG. All right? Okay, I'm not kidding. It's really that. You want me to No, like show it to you? All right. Okay, you asked for it.
Hello.
Right. Kindly turn off your mics. Kindly turn off your mics. Kindly turn off your mics. Here is the ghost. Okay, I should be turning the mics myself. Turn off the mics, please. Here is the ghost. Do you see the ghost? This is your ventricular tachycardia. Right? Do you see the ghost? This is a perfect ghost here. Okay, this one here. You guys follow? Like, look at it. It's literally like somebody's wearing a blanket and they're holding their hands up and trying to scare you, right? So TCA overdose, ventricular tachycardia, broad complex tachycardia, it's life-threatening. Ghosts are gonna kill you, right? So I'm hoping you guys understand. Right. Okay. Let's read the question and see if you can give the answer. First of all, tell me what's happening with arterial blood gas. Can you read the arterial blood gas for me, the ABGs? How is his pH? Acidotic or alkalotic? Acidotic or alkalotic? How is his pH? We're ending at 7, unfortunately. I think this is going to be the last question, right? I have another commitment. I apologize for that. We'll be continuing for sure. Okay, this is acidotic. All right. Second thing here is, once you look at the pH, look at the respiratory rate. How is the respiratory rate? Is he having raised respiration? 31, breathing 35. Raised, all right. Okay, that's number one. Okay, that's true, that's true. But look at the scenario. Look at the scenario. It says, symptoms of chest pain, abdominal pain, altered mental status, right? Consume the whole bottle of the thing. Okay, so and respiratory rate is 35. Is it metabolic acidosis or respiratory acidosis? I mean, I don't want you to go in through the PCO2 or the oxygen or the bicarb, but tell me, by just looking at the respiratory rate and the pH, is it metabolic acidosis or respiratory acidosis? It's metabolic? Okay, all right. PCO2 is 3. PCO2 is 3. PCO2 is 3. 3. PCO2 is 3. Okay, decreased PCO2. What does that show? Alkalotic thing happening or acidotic thing? Alkalotic, so not coinciding with the pH, right? And bicarb is 18. Bicarb is 18. So you guys are saying it's metabolic acidosis, right? Now, here's the thing. When there is a drug that causes metabolic acidosis, right? Metabolic acidosis, first of all, here's the thing. I don't know why I said this twice, but for there to be a compensation, a thing should be going on for a while, right? Should be going on for a while. Maybe it should take 2 or 3 days. It could be that there is a compensation, right? Or it could be that it's about to change into something else, right? Okay, so she took something and now she's having chest pain, altered mental status, and palpitations with nausea. What medication do you think they've taken? Is it paracetamol, diazepam, enalapril, diclofenac, aspirin? You said metabolic acidosis, right? Aspirin can cause raised respiratory effort. Okay, raised respiratory effort for sure. All right, it affects your liver, right? In paracetamol poisoning, what do you have? Metabolic alkalosis or acidosis? Have you ever seen it? What happens in paracetamol poisoning? Have you ever maybe, Googled it? Yes. So that also happens in that one, right? Okay. And you are thinking this metabolic acidosis too. So how do you know which one is it? Is it aspirin or paracetamol? Now, have I confused you? I hope I have. That is my thing to do. That is my thing to do. What is it? Is it paracetamol or is it aspirin? Okay, you would tell me. I'm here to do my work, and I think I've done it successfully because that's what your brain would do on your exam day. It'll confuse you so much that you wouldn't remember things. Now, I don't know if you remember, but I'm going to give you the question again, and you tell me what it is. Yes, you guys are saying 5. Let's see if that is true. Incorrect. 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 This is metabolic acidosis and possibly due to aspirin overdose. They initially hyperventilate, leading to respiratory alkalosis initially. This is why I said that even though this person's having metabolic acidosis, this person was having high respiration, right? When you respire a lot, you develop what? You develop what? If this was panic attack, in panic attack, do we have shortness of breath? Do you have increased respiratory rate? Hear me out. Hear me out. Are you following? Here's the thing. Here's the thing. If you have panic attack, anybody ever been through one? I hope not, but if you have, you would see, if you've observed, they would have shortness of breath. Shortness of breath would do what? It would increase the carbon dioxide, right? And because of that, you would eventually develop respiratory alkalosis, right? Respiratory alkalosis, right? Respiratory alkalosis. So this person did have respiratory alkalosis earlier, right? Okay. Respiratory alkalosis earlier, but now the ABGs show that this is metabolic acidosis, isn't it? Right? So respiratory alkalosis converted to metabolic acidosis is aspirin. Aspirin poisoning, right? Aspirin poisoning. Don't forget that. I hope I said the things correctly. If I'm wrong, please Google and understand, because I'm here to make sure that you understand for sure and to confuse you. But, yeah, it could be compensation. It could be compensation. But here's the thing. Here's the thing. That almost all the drugs, when they come, how to differ from paracetamol? In paracetamol, you will not have uh, high respiratory rate. Most likely, you wouldn't have hyperventilation. In aspirin, you do have hyperventilation. Secondly, in paracetamol poisoning, what would you have? You would have liver profile. You wouldn't have the ABGs. You would have the liver profile, right? Mostly in Plab1 scenarios. I'm hoping this makes sense. No. I said first it's respiratory alkalosis because of this hyperventilation, right? You see it here, hyperventilation. Then this is what? You guys had said it. This is metabolic acidosis. Look at the pH. pH is low. pH is low. PCO2 is low, right? When the pH is low and PCO2 is low, the cause is most likely metabolic. It's not respiratory. If the cause was respiratory, then they should be in opposite digestion. They didn't mention how long ago they were ingested. Yeah, that's true. That is true. But do you see the change of scenario? If she was, if she was techie, like if she was having hyper respiration, right? If she was hyperventilating, then with that hyperventilation, what do you see here? You should be seeing what here? You should be saying respiratory alkalosis. Do you see respiratory alkalosis? That's why I'm trying to simplify, and I'm going to end on this. I'm going to end on this because it's been around 2 to 3 or class now. Now here's the thing. Here's the thing. See, if you are having respiratory alkalosis, I hope you guys are following. I'm hoping I'm saying the right thing. And if I'm incorrect, the ones who understand, please do tell me, right? Because I am also here, but what we're trying to do is we're trying to learn a better way, right? So here's the thing. If you hyperventilate, you're going to have respiratory alkalosis. Remember that. I don't care if it is pulmonary edema, pulmonary embolism, or is it panic attack. The difference would be that you would be hyperventilating, right? Your oxygen levels, this one would be normal in panic attack, right? But in pulmonary embolism, the oxygen levels would be low, right? Okay, the concentration in the ABGs would be low. Do you guys follow? Is it understandable, Dr. Hina, Dr. Hamza, Dr. Baram, um, Dr. Bachchan? Do you guys follow? All right. Okay, so that's there. That's there. All right. But if there's a scenario where the person is hyperventilating, right? Three scenario people hyperventilate, if for Plab1's sake, aspirin, panic attack, pulmonary edema. Okay, we'd do that, inshallah. All right. We'd get there. Please don't worry. We're gonna do everything. These things would get repeated. All right. Here. Aspirin, paracetamol, right? Aspirin, paracetamol, and pulmonary edema. Person would have hyperventilation. Look at the oxygen, look at the pH. If the pH is higher, the oxygen is normal, most likely panic attack, right? pH higher, oxygen normal, most likely panic attack because we're thinking respiratory alkalosis. Do you guys agree? Hyperventilation, pH higher, oxygen normal, panic attack. Respiratory alkalosis, panic attack. Hyperventilation, pH higher, oxygen low, pulmonary edema, right? Pulmonary edema. Hyperventilation, pH low, oxygen normal or not, we don't care. Most likely aspirin. Okay, most likely aspirin. Clear? Aspirin toxicity is the only one that first turns out to be respiratory alkalosis. Later on, it goes into the liver, it works its way there, and then it starts to be metabolic acidosis. Paracetamol would cause metabolic acidosis, right? Because your liver is getting destroyed, it's getting acidotic, it doesn't like it, it is going to be a result in the ABGs as metabolic acidosis, right, guys? Do you guys understand? I'm ending on this note. I spent around 10 minutes and helping you understand this question. So we're ending it right now. And inshallah, tomorrow we'll be doing cardiology, continuing from there. And I'll be uploading this for all of you because I didn't plan on doing it. So don't worry about it. All right. Thank you so much. Have a great day.